with our first reported possible case of monkeypox. The Public Health District tonight calling it a probable case because the virus sample taken from a young man in his 20s still has to undergo an official test at the Centers for Disease Control. Our Michael Gibson has been looking into this story and joins us here in the studio tonight with new developments. Michael?
Well, the reason why this case isn't confirmed yet is because the CDC, again, is the only agency who can run the test to say proof positive that it is the virus. But we actually may never know, according to our assistant director at the health department, because the CDC is so swamped with samples from across the country that it may never be able to get to test ours. But the big question is, why did we have to find out about this through Spahn Hospital last night instead of the city and county health department? Our first possible monkeypox case turned up here at Christa Spahn Shoreline. We have learned that it was a young man in his 20s who was treated and released from the hospital. He was then told to try and limit his contact with anyone and everyone. Now, we initially heard about the case from the hospital officials there instead of the city and county health department. We asked the assistant director of the health department why that happened.
We receive notifications directly from the state. So the state puts it into a system called the NEDS. This is a National Electronic Disease Surveillance System. And in that system, we pull down the information, the reports from the lab, and then we analyze those results. So when we looked at the results, we looked at there was a positive for orthopox, not a positive for monkeypox.
That sample is then sent on to the CDC to determine if it is in fact monkeypox. That agency is the only one who does that kind of testing. Now, just because the sample was sent, Dr. Gonzalez says that doesn't mean that the CDC will ever get around to testing it, and we may never know the results. We also asked Dr. Gonzalez if the health department was even going to report the possible case.
Whenever we get anything like this, even as a probable case or if it was a suspected case, right? We would put something out, and which we definitely will. We definitely are, right? I think that's the better word for it. We definitely are. It's just a matter of getting it right.
And again, Dr. Gonzalez saying that the city and county health department got its information from the state in this case because Christa Spahn Hospital reported it through that government system known as NEDS. And at this time, he also says it's unclear where the patient got the virus because he did not report that he had traveled out of the area. Mike?
All right, Michael, thanks for that. Hey, of those who have monkeypox, over 97% are men and over 99% are 18 or older. Public Health Region 11, which includes the Coastal Bend and the Valley, currently reporting 4 cases. The first probable case of monkeypox in the Coastal Bend is not included in those 4 case counts.